This doctor was faced with a patient whose jaw looked like this, and if he didn't act fast, she could have ended up on life support.
This is a huge abscess that could jeopardize her airway, so it's important we deal with this immediately. I need to drain this infection, obtain cultures, and get her on antibiotics right away before she finds herself intubated in the ICU. This procedure is done with the patient asleep. I anesthetize the areas and start in the mouth. I make a crestal incision and dissect the bone. When I push on the swelling in her neck, I'm able to express additional purulence into her mouth. I press on the floor of her mouth to the sublingual space and express as much pus as possible. I'm happy with the drainage so far, but there's still fluid in her neck. I need dependent drainage, so I turn my attention to the neck. I make a skin incision and then dissect with a hemostat into the submandibular space. I obtain cultures through the neck incision because it's cleaner and less contaminated than the mouth. I proceed superiorly through the submandibular space, along the lingual aspect of the mandible, through the mylohyoid muscle, and into the sublingual space. Finally, I connect with the initial intraoral incision. Now that I have free access to this entire abscess, I place a Penrose drain and secure it with silk sutures. She did extremely well and made a full recovery within days. Also keep an eye on my website, theopenreduction.com, which will have advanced surgical cases to help you hone your clinical skills.